Technique of massage. One often speaks of massaging the prostate, but it is prudent, in view of the fact that the vesicles may be inflamed, even when they feel normal, always to massage the vesicles first and then the prostate, no matter which organ feels the most diseased, though paying most attention to obviously diseased regions. The question whether these organs should be massaged severely or gently cannot be decided academically. A physician who rubs so hard as to make many of his patients faint loses many a case before it can be cured. And on the other hand, the physician who massages too gently fails to cure certain cases that require severe rubbing. The intelligent practitioner will rub gently at first and increase the severity of the manipulation up to the point of the patient's endurance and with an eye to the results obtained. Severe massage may do physical harm by exciting acute prostatitis, vesiculitis, and epididymitis. Mild massage very rarely does this. No two physicians massage with precisely the same method or with precisely the same severity, as patients are quick to note. A simple method is to begin upon one vesicle and, reaching up as far toward its fundus as possible, to press upon it and then withdraw the finger in a zigzag way until one reaches the prostate. This maneuver is repeated half a dozen times and then the same treatment given to the opposite vesicle. If the vesicles are impalpable, this is enough. If distended or indurated, the maneuver should be repeated often enough to make a distinct reduction in their size, if the patient can bear so much manipulation. The finger is then brought down to the prostate. Hard angular indurations in and about this organ had best be avoided, and pressure made chiefly upon the more yielding portions of the gland. Beginning with one lobe, pressure is made upon it either with a to and fro lateral sweep of the finger or with a circular motion. This manipulation, if gentle, may be continued for 1 minute. If severe, half a dozen strokes may suffice. The same treatment is given the opposite lobe of the gland, and the manipulation concluded by a half dozen strokes over the prostatic sinus for the purpose of emptying the main ducts into the urethra. The general tendency of all such massage should be to express the secretions in the direction of the apex of the prostate. Meanwhile, watch is kept for the expulsion of secretion from the meatus. This is caught upon a slide for examination. Massage should usually be repeated not oftener than 2 or 3 times a week. If severe, longer intervals are better. In exceptional cases, when the return from massage is very great, gentle rubbing may be employed once a day. Massage should be continued until the subjective symptoms are relieved and the return from the rubbing very slight and not densely purulent. If the return to normal is rapid, one may continue to rub until all pus disappears. The success of treatment must almost always be verified by 3 or 4 observations at intervals of 1 to 3 months. If pus has reaccumulated during those intervals, a few rubs will get rid of it. Contraindications to massage. Massage is dangerous only in the presence of acute inflammation of the urethra, the prostate, the vesicle, or the epididymis. But massage is harmful in case it increases the patient's subjective symptoms instead of relieving them. It is also harmful in case it so hypnotizes the patient that he thinks he must come for the rest of his natural days to be rubbed for the relief of imaginary discomforts. Such patients should be discouraged from massage by all possible means. Their proper cure is sexual relief by matrimony.